Well, welcome to today's talk. It's Thursday the 19th of August today. Now, yesterday we were talking about the plans by the Biden administration to bring in a third dose or an additional dose of vaccine for those that are fully vaccinated. This is probably going to start round about the 20th of September, we believe, as long as there's the requisite approval given in the States. And we did say that quite a lot of this was based from data from the UK and data from Israel particularly. And we did point out that the United States data was lacking. Well, I think they must have been listening because they produced 3 papers yesterday. Now, this is the first one we want to look at here. New COVID-19 cases and hospitalizations among adults by vaccination status. New York, and its data collected from May the 3rd to July the 25th. Now, the whole paper is there. I actually quite like these CDC papers. Morbidity and Mortality is the CDC's scientific reporting journal. The reason I quite like them is they are in reasonably intelligible language. Considering the technical detail they impart, they're actually quite comprehensible. If you want to spend half an hour, 40 minutes reading through it, do it. It is actually pretty interesting. But I'm just going to condense it for you here. So this is the report. This is the first paper we're looking at. Study from New York, first to assess vaccine protection against coronavirus in Delta times. So here we have Delta-related data. And this is what we've been lacking from the United States. And now we have this unambiguously presented in these papers. And these are very thoroughly written and reviewed papers. So this is good quality data. Now, data for New York, as we say, 3rd of May to the 25th of July. And of course, this is population-wide studies. This is 10.5 million people. So the numbers are very high. Now, modest drop in vaccine effectiveness against lab-confirmed infection. So what they found in this study period was, May the 3rd, the protection against lab-confirmed infection was 97% with the mRNA vaccines. Now, these papers don't say much about the Janssen Johnson & Johnson vaccine. We know that data is still being processed. We are expecting that soon. So the data here is primarily for the Moderna and the Pfizer vaccines. They're aware of the deficiency and they are working on that. So it is just a matter of working through that, which they are doing. So it's gone down from 97% at the beginning of May to 79.8, basically 80% by the 25th of July. So there is a modest drop in vaccine effectiveness against lab-confirmed infections, whether symptomatic or asymptomatic. So that looks discouraging because it's gone down from 92% to 80% basically. But there's a very big but here. And this is it. Age-adjusted effectiveness against hospitalizations for people that are fully vaccinated with an mRNA vaccine. Age-adjusted means they've taken into account, well, they took into account age and they took into account lots of other things, comorbidities, immunosuppression. It's a very thorough piece of research. So even accounting for all that, this was the result that they came up with. So that's the data from May the 3rd. That's the data from the 25th of July. And you can see that basically it's 91.9 to 95.3% protection against hospitalisation on the 3rd of May. And on the 25th of July, it's 91.9 to 95.3% protection as well. So these are the same. Now, they weren't identically the same at these times, but they went up and down a bit in these times. But what they're saying in the way they present this data is there was no difference between the cases. In other words, even though more people were infected, they are now saying basically definitively from this study of 10.5 million people in New York area that there is no reduction in the protection against hospitalisation, certainly not a significant reduction. And this, of course, is remarkably good news. Now, what were the factors here? Well, in this time period, the Delta variant went up from 2% to 80%. And of course, you and me watched this painfully go up. We anticipated it when it was at 0.5% Delta variant. We said this was going to happen. And of course, it did. So we had the introduction of the more transmissible Delta variant, plus we had widespread relaxations, the two of those together. And we had the increase in cases that unfortunately we've seen. The implications, direct quotes from the paper. Current authorised vaccines have high effectiveness against COVID-19 hospitalizations, confirmed by the CDC data. But effectiveness against new cases appear to have declined in recent months, again, now confirmed with CDC data. These findings support the implementation of a layered approach centred on vaccination, as well as other preventative strategies. Now, this is quite a carefully worded sentence here, really. So it's a layered approach. So in other words, we need good hygiene, we need social distancing, we need good ventilation, we need mask wearing, we need all those things, but it's centred on vaccination. Vaccination is clearly the key thing they are talking about, as well as other preventative strategies. Frustratingly, they don't really say what these other preventative strategies are, other than non-pharmaceutical interventions that, of course, we all now know and love, or do we love them? So anyway, that's good. I think that's basically good news. I feel a bit more encouraged after yesterday's somewhat doom and gloom. Sorry about that yesterday, but it was the way it was looking. Now, this is the next paper here. Quite a long title. Effectiveness of Pfizer, BioNTech and Moderna vaccines in preventing SARS coronavirus 2 infection amongst nursing home residents before and during widespread circulation of the Delta variant. So this is what it says. It's particular data from nursing homes, and again the full article's there. And again, it's really quite readable. But as usual, I'll give you the pre-say of it, and always, of course, I put the references. So this is based on 85,000 weekly reports from a good selection of nursing homes. So it's based on good quality data again. And again, it's only talking about the mRNA vaccines. The Janssen, Johnson & Johnson single dose is still to come through. Effectiveness against infection declined in nursing homes as Delta increased. So the resistance against infection went down as Delta increased. Partly due to the Delta, but also partly due to a degree of waning immunity as the vaccine protects less against infection. So early March, it was 75% protection. By late June, that had gone down to 53% protection against PCR diagnosed infection. So we see quite a reduction in the level of protection against infection in March, April, May, June, over a 3-month period. Now, this particular paper here did not comment about hospitalizations, and given that it did not comment about hospitalizations, we can't comment either. Of course, we assume that there is significant protection against hospitalizations maintained as per the previous paper, but it didn't say that, so we can't infer it from this paper. Direct quotes: vaccination for visitors and staff is crucial. Visitors and staff. Additional doses of COVID-19 vaccines might be considered for nursing home and long-term care resident facility residents. So these are the people that will probably benefit from a third dose of vaccine. So definite reduction in protection against PCR diagnosed infection. No comment about hospitalizations in that particular paper, but we assume they remain good. Now, the third paper, and I think this is probably the only one we'll do on this particular video. The third paper is there. That's this one. Sustained effectiveness of Pfizer, BioNTech and Moderna vaccines against COVID-19 associated hospitalizations among adults. United States, March to July 21. Now, what they did here, they went the other way around. They started in hospitals and worked backwards, is how this one was worked out. So what they did here was they analysed patients from 21 hospitals. And as it says here, the number of patients, the number in the study was 1,129. So a good number taken from 21 hospitals after 2 doses of mRNA vaccines, and the samples taken across 18 states. So it's a good sample size, no question about that. They noted substantial protection against hospitalisation. No decline in protection against hospitalisation over 24 weeks. So this is remarkably encouraging. This is what they actually said. No decline in protection against hospitalisation over 24 weeks. And the effectiveness was reported steady. So in March it was effectiveness was steady 86%. So 86% basically all the way through. There was actually a very small reduction, but basically 86% protection. It did go down to about 84%, but that difference is not statistically significantly different. So effectiveness was steady, 86% protection against hospitalisation. Immunocompetent adults, it was 90%. So in other words, immuno-incompetent adults, there was more of them were admitted. There was less protection. If it's immunocompetent adults, there was 90% protection. So most people, of course, are immunocompetent unless you know you've got some condition that would compromise your immune system. So 86% overall, but better levels of protection if adults were generating a good immune response. And this remained consistent during the Delta surge. Now, this is quite a relief, really, because what it means is that hospitalizations are not increased by the Delta variant. That's what it means. That hospitalizations aren't increased by the Delta variant because it remains consistent during the Delta surge. There was no increase in hospitalizations during the Delta surge. So they did take two groups at 2 to 12 weeks. After the second dose, the overall effectiveness was 86%. And as another group at 13 to 24 weeks, it went down to 84%. But the claims that they're making are justified because this is not statistically significantly less. So it went down from 86 to 84% over that period of time, but that is not a significant reduction. So they are quite justified in saying, as they did, no decline in protection. The protection is essentially the same. There's not a significant reduction in infection levels. So that is really pretty good news, quite a relief actually. Michelle Walensky commenting on this, CDC director, examining numerous cohorts through the end of July and early August, 3 points are now very clear. First point, vaccine-induced protection against SARS coronavirus 2 begins to decrease over time. And we know that the time they're looking at is probably going to be 8 months for a booster dose. It's probably what they're going to be looking at. Second point, that was the first point. Second point she wants to make, vaccine effectiveness against severe disease, hospitalizations and deaths remains relatively high. Pretty good news. And third, vaccine effectiveness is generally decreased against the Delta variant. So what we're seeing is people in Delta variant times are getting more infections. They're testing positive more often, but they are not being hospitalized more often, according to this data. And that really is quite a relief, because we've ummed and ahed since Delta came out. Is it making people sicker? Is it causing more hospitalizations? This data is saying it is not causing more hospitalizations. What these papers do not say is whether it's causing increased hospitalizations in younger age groups. It doesn't cover that. The data only tells us what the data covers, so that's all we can go by. But overall, really pretty good news, and now backed up by hard numbers. And I think we can assume highly competent statisticians working for the Centres for Disease Control. Now, there is a similar paper just published in the UK today, but I'm not going to do that just now. I'm going to do that next, because I want to go to Mona, who is a research scientist in France, and she's kindly done us a good report on the situation in France. So we're going to go over to that now. And learn about what's going on in France. And there is some challenging news in France, I think it's fair to say. So Mona, thank you very much, and over to you.
So hello John, hello everyone. So I'm sending this update from France, where I live and where the situation does not look good for the moment. to be perfectly honest, the situation is dramatic in the French overseas territories, and I will talk about that later. So I'm a research scientist and I've taken interest in COVID. I've sent some papers to John, and he has kindly talked about some of them on his channel. So that's how he asked me if I would like to do an update on France. So here is a quick update. As you can see on this graph from our world in data, cases have been rising in France since July. So the average number is around 23,000, quite close to what we see in the UK. In France, 94% of these cases are caused by the Delta variant, of course. And if we look at these graphs, we can see that France has more or less the same trajectory as the UK, but with a 5-6 week delay. So the cases are still increasing globally, but the rate of increase is a bit slower. But we do have to keep in mind that testing is not as good as it is in the United Kingdom, but it has gone up recently, in fact since the beginning of August, and this is mainly because of this new pass that we have, and I'll discuss this later. So this slide shows the distribution of the patients in different regions in France. The highest numbers are reported from the south of France, as you can see here, where people are and have been spending their holidays. So some hospitals in these regions have cancelled elective surgeries, and some are reaching full capacity. So some patients have been transferred to other regions, mainly to Brittany and to north of France. One hospital, in fact, is the University Hospital in Bordeaux, is really at full capacity, and doctors have to make difficult choices sometimes. So this other map shows the high number of cases that we have at the moment in the south of France. Of course, the problem would be when all these people come back from holiday and they will socialize, and this will result in more spread in other places, as France is not as vaccinated as the UK, and as we know, vaccines need more time to work. So this is a heat map of the positivity rate per age group. It's the 7-day rolling average. So we see the distribution of cases in different age groups. So the highest numbers are in young adults, in particular those between 20 and 29. And the numbers were very high in this age group. As you can see here, they were over 600. Here we have 630. But now they are coming down, and we have around 472. So this graph is more or less the same thing as the heat map. And these young adults had not been vaccinated in July, and this is why on the 12th of July the president made a speech asking people to get vaccinated, and he said that the pass will be required for having access to different places such as cinemas, clubs, restaurants, shopping centers, hospitals, and so on. So vaccination has already been mandated for the healthcare workers. And I have to say that this is not a vaccination pass. A negative PCR test will also do. But PCR tests will no longer be free from September, of course. And as you know, since this pass, protests against the pass and mandatory vaccinations have been going on, in fact, very regularly, every Saturday, against this pass. So this has become, unfortunately, a political issue. So the health minister, Olivier Véran, said that people with the pass won't require to wear masks indoors. This is much like what CDC had said before. But I'm glad to say that since a couple of days in some places, masks are being mandated again, which is good. What has changed also is that if you are fully vaccinated and you are a contact, you won't be needing to isolate or self-isolate and this is going to be from September. So as we see, the main goal of this pass is to encourage vaccinations. So this graph shows you the R value, which has been estimated from the PCR tests and the number of patients in accident and emergency. The R was quite high. The value was effective R was quite high, but now it's more or less around 1.09. So, as I mentioned earlier, the situation is really dramatic in the overseas territories, particularly in Guadeloupe and Martinique, where strict lockdowns are in place now, at least until the beginning of September for the moment. And as you can see from these graphs, the incidents have gone from 54 to more than 2,000. And this in only 4 weeks. But this is the Delta variant, as we know. The main problem and the main reason is because less than 20% of the population was vaccinated in these regions. So the majority of cases were in young adults, and especially those between 20 and 29, and the incidence for this group was over 2,800 a few weeks ago, but it has come down, and unfortunately this rate is going up again, as a few days ago I read that it can be as high as 4,000 in some age groups. As a result of this, hospitals are overwhelmed and healthcare workers have flown from France to Guadeloupe and Martinique. Some hospitals are over 225% occupancy for COVID patients, and particularly in Martinique. But most of them are over 150%. A large proportion of the patients are really young, in their 20s or their 30s, and the doctors say sometimes they are forced to choose between patients, and this has become a difficult choice. So in these pictures you can see the crowded corridors of some hospitals. Patients are in corridors because no beds are available, and they are admitted in tents, and there is a military hospital in the parking lots. And this is really unfortunate, as this data shows, as this graph shows, the admissions are mostly in those who were not vaccinated. So these graphs are from Martinique, and as you can see, there were no hospital admissions for the fully vaccinated. This was until up to 1st of August, of course, and there were 560 hospital admissions for the unvaccinated. But if we look globally at hospitalizations, we see that on the 12th of August, we have more than 9,000 patients in hospital with COVID-19. Daily admissions are around 800, more than 800. And this is on the 12th of August, and now we have more than 10,000, unfortunately. So as a result, the number of patients in ICU are going up. We have more than 1,800 patients in ICU, and the daily admissions are around 180, more or less. And this is because French were less vaccinated when Delta arrived. And of course, we would expect that. So this graph shows the overall occupancy of the intensive care units for COVID patients. Of course, the average is now around 29%, which is not bad at all, but especially compared to the first wave where the average was 136%. So, but this is the global average, and as I said before, some places in the south of France are at full capacity, and in Martinique and Guadeloupe, we are over 200%. So I'm afraid things are globally not looking good, as confirmed cases and positivity rate are going up by 5%, as you can see here. Hospitalizations are up by 39%, ICU admissions by 50%, and deaths by 28%. So what about vaccinations? As for vaccinations, this graph shows us that the numbers started to come down from June, and really the numbers dropped in July. And after President Macron's speech on 12th of July, they suddenly started going up. Here you can see the steep rise in vaccinations. But I'm afraid that they are coming down again since the beginning of August. So in France, we have 69%. This was a slide from a few days ago, but now today it's around 71% of adults or of over 12s that are fully vaccinated. And compared to England, we see that to the UK, we see that in the UK, I think this is around 76% or even more now. So the problem is that in France we have 19% of the population who is not vaccinated at all. And in this group, we still have some vulnerable people. We do have people who are in their 70s, in their 60s, and who refuse the vaccine, who still refuse the vaccine. And this is so unfortunate because, as you can see from the following data, which was released a few days ago, the rates of hospitalizations, admissions in ICU, and death are really low in those who are fully vaccinated, here in green. Even those who have had one dose, we see very low rates in comparison to those who have not been vaccinated. As for children and young adults, on the 10th of August, we had 50 hospitalized children up to 9 years. 2 of them are in ICU. We had 72 hospitalized children between 10 and 19, or young adults. 14 are in ICU, and 272 hospitalized young adults between 20 and 29. 52 are in ICU. Of course, these numbers have changed a little bit, but they are more or less the same. So just to summarize, things are not looking that good at the moment, as all indicators are going up. And the situation, of course, is very sad and dramatic in the overseas territories. But vaccinations have gone up sharply the last few weeks, and we have the pass now, which is good. But contact tracing is not good at all in France. People have not really downloaded the app, unfortunately. So I'm afraid that in September we'll see surges, especially with the schools reopening and people going back more or less to normal, public transports, universities going back to normal. And I do not think that a lot has been done with regards to ventilation in schools or universities. And as we are currently on a quite high plateau with between 23 and even 30,000 cases daily, we will probably see surges in September or in October. But, well, we hope for the best, and we'll see what happens. So these are the different sites which I use to collect the data and to make these slides. Thank you very much, and thank you for listening.
Yeah, thanks for that, Mona. That's a very, very thorough report, actually. She's gone through absolutely everything relevant there, really. I like the way the graph went up in vaccinations when people realised they had to pay for their own tests. So that's quite a nice move. But Mona's main point there is we've got this autumn to get through yet, and there is going to be some difficulties there. But so good to see that the vaccinations are really going up in the UK, France, and indeed all over Europe now. So grounds for optimism, but not quite there yet. And spare a thought for the people in the French overseas territories that are having such a difficult time at the moment. So thank you very much, Mona, for that. I actually found that really interesting. Actually, you went through everything really systematically and nicely, and thank you for watching.